Good morning, everyone. Nice to meet you. My name is Ronit, and I'm the CEO, and our model is Ayelet. Actually, Ayelet is not a very good model for us today because she used to have a severe acne, but we treated her with the Azopil peeling, which I will be speaking of, and Azolite product. So for today, she has even not remains of acne. She has some red marks and some scars after the acne, but we still will use her face to demonstrate the Azopil. So we're now speaking about Azopil. Azopil is a peeling for the clinic. It contains 20% azelaic acid, 10% lactic acid, and 2% salicylic acid. We use it mainly for acne treatments. We find it very useful in calming the inflammation of the acne and normalizing the sebum secretion and helping cure the acne. When we use it while in combination with the home treatment, it can accelerate the results. Also, we can combine it, this peeling, with the pigmentation treatments, the peeling for pigmentation in the clinic. In that case, we use first the HA peeling and then 1 or 2 applications with Azopil. Also, you can even combine it in anti-aging peelings in the clinic. First, you use, of course, the HA peeling to prepare the skin, and then 1 or 2 applications with Azopil, because azelaic acid also normalizes the sebum secretion. You know that with the age, the skin secretes less sebum, which is not very good for the total look. So we find in researchers that when we do a series of peeling with azelaic acid, we can normalize, and in the U zone, not in the T zone, but in the U zone, we can even raise a little bit the sebum secretion, which is good for our purposes. So because the azelaic acid is anti-inflammatory component, we can use it even in inflamed acne, this Azopil peeling, even in inflammation up to level 3 inflammation. I know that when we treat Azolite, the product, the home product Azolite, we are very careful when the skin have inflammation. So in inflammation grade 1 or 2, we use Azolite in very gentle and different way. And if it's grade 3 inflammation, we don't use it at all. But when we're speaking about Azopil for the clinic, we can use it up to 3 grade inflammation. So with Azopil, you can do several applications in the same treatment, up to 4 applications in the same treatment. Usually with new patients that you don't really know his skin, you will do 1 application in the first visit, and in the next visit, you will go up to 2 and 3 and 4 applications. Although I have to say that when you are more experienced with the peeling, you can get new patients and start with 2 or 3 or more applications, even if in the first visit. But don't do it when you start getting to know the product. First, check the product and then decide whether you want to do more than 1 application in the first visit. Let's look at the protocol. We start with the cleansing. In this kind of peeling, we do not use skin brush, which is the dermabrasion product, because we don't want to, to scrub and to scratch the skin, the acne skin. We clean the face either with the soapless soap or with a gentle clean. Gentle clean is a micellar water that goes out like a foam. Maybe we will check in this demonstration to use this. But you can decide, and also you can do both. With very sensitive and inflamed skin, you can skip the soapless soap and use for cleansing the gentle clean. This is gentle clean. But our model doesn't have inflamed skin or inflamed acne. I could use definitely the soapless soap, of course. So we massage the cleanser, whether it's soap or gentle clean, into the skin. It will be, if we use the gentle clean, as you can see, the foam is absolutely absorbed into the skin. You don't see the foam. I will put the camera closer so you can see Ayelet. Okay, so you cannot see the foam because it's inside the skin. And then we take a wet towel and gently remove the cleanser. Turn to the side. Yeah, you can see the remains of the acne that she had before. As I said, she had severe acne. Show me the other side. But the acne was treated in our clinic with Azopil and with the azelaic acid, so it's gone, and we have only the remains. Now, the next step is using the Azopil. We will put 2 or 3 ml into the mixed bowl. And we will use a gauze pad and put the peeling on all the affected areas. I want to note, let's go back to you. So it's important to understand we apply the peeling actually not only the affected area, but all of the unbalanced areas. So sometimes the patient is in the clinic and there could be an area with no pimples, but every now and then there are pimples. So this is unbalanced area and we apply the peeling to this area. But all of the areas of the face that are really quiet and balanced can be excluded from the treatment. I mean, you don't have to put the peeling on the quiet and normal areas. Another thing, there is another way to apply the azelaic acid, the Azopil. You first have to make a total application with a gauze pad, but you can, in addition to that, you can put on certain pimples, on certain papules or pustules, to use an applicator, to dip the applicator in the azelaic acid, and to work like separately in a certain pimple. So you take the applicator, you dip it in the Azopil, and you like touch the pimple for several seconds. We, of course, after application, we will check on the patient. We will see if he feels okay. How are you feeling?
Okay, I'm fine.
Sometimes the skin gets a little bit red, maybe a little bit of itching or tingling. They are all normal and it will pass. So Ayelet is very regular to this peeling, so she reacts okay, she's okay. Although she has sensitive skin, but you know, she got some treatment with the peeling, so she's really okay. So we leave the peeling on the skin for 5 minutes. And after 5 minutes, we can make another application. As I said, up to 4 applications in the same treatment. So in case the peeling is performed as a preparation to comedone removal, or you know, if it's the first visit or it's a preparation for comedone removal, let's divide, let's be more clear. If we intend to remove comedones after the treatment, so we can do 1 application of Azopil and then do the drainage of the comedones, or we can do one application of Biopeel glycolic or Biopeel lactic, which is HA exfoliator, and then one application of Azopil, and then do the drainage. If the skin is sensitive and you're concerned with the two applications before Comedone drainage, you can do another thing. You can pour into the mixed bowl 1 ml of Biopeel glycolic, for example, and 1 ml of Azopil. So it's a peeling that is a mix of two kinds of peeling, and it's less irritative than two applications. You do one application with the mixed peeling. Okay, so it's important that you note when you do the two kinds of peeling, one application of HA peeling, like Biopeel glycolic or lactic, and after that application of Azopil, always you start with the HA peeling. You start with Biopeel glycolic or lactic, and only afterwards you do the Azopil. Actually, this is for two reasons. Reason one is because the glycolic or lactic acid prepare the skin to a better penetration of the azelaic acid, because it removes that skin cells, like opens the skin, and the next ingredients will penetrate faster. This is one reason. And the second reason is because, if you are experienced with the peeling, you know that the texture of the peeling, Biopeel glycolic and lactic are like water, like alcohol. They're light. And the Azopil has a little bit of viscosity. So if you were to apply it first, it can interfere with the penetration of the other peeling because of the texture. Yeah, so another thing, if I didn't mention, when we apply the peeling, we use only gas pad, not a brush. And you can, with Azopil, you can use an applicator, but not instead of the gas pad. You use first gas pad to do all of the entire application. And then you can put some point of with applicator. But the main device is the gas pad. It's the most effective. So we have we had one application of Azopil. We wait 5 minutes. If you want to continue, you don't have to neutralize. You don't have to remove it. You just put another application above the first application. So in this case, we will stay with one application, and the next step will be calming to calm the skin. So to calm the skin, we use the calming mask. So let's get closer. Actually, I did not treat the forehead, so I don't have to put the calming mask on the forehead. The forehead is normal, and she didn't have acne in the forehead, so I put calming mask only on the treated areas. Yeah, my patient asked for fun. Okay, she feels a little bit heat, which is normal. You can definitely, let's come back to me. So you can definitely use any cooling device, whether it's, we have some kind of gadgets for cooling the skin. Anyone will be okay. It doesn't compromise the peeling. It's okay to use them. Many times after we finish the peeling, and before that it was not itching or tingling or irritating, but when we put the mask, so for some seconds the patient can feel some tingling or irritation. This is because the mask is inclusive, and because of that the mask hits the skin, and the skin was before like heated, so it can be a little bit irritating, but it should pass. So we put the calming mask. We leave it for 10 to 15 minutes. We can put the calming mask by a brush or even with the hands. It's okay. And then when we want to remove the peeling, we can do it by a dry towel. So I want to show you something about removing the mask. Maybe we come closer. So normally we just take off the mask with our dry towel, like this. And of course, we can leave a little amount of the mask and massage it into the skin in order to continue the relaxing and calming of the skin, the rehabilitation, the recovery of the skin. You know that the mask have very good ingredients they are disinfectant and help the skin recovery. So it's important to leave a little bit of the mask on the skin. You cannot see it, but it's acting on the skin. Sometimes the skin is inflamed. This is not the case, but sometimes we have big wounds that maybe even are hurting and inflammation. So if you should do this motion, you can irritate the skin. So in those cases, you have to be gentle and like put the towel and take it and put it again and take it and like very gently remove the calming mask. The idea is to not to scrub the skin and not to cause irritation on the skin while removing the mask. So this is another way to remove the mask gently and with no irritation. Yeah, in the end of the treatment, we will use, I'm looking for it. And to finish, we use enriched cream, which of course I use the cabin size, the big size. This is enriched cream. So enriched cream is a moisturizing cream with very light texture, with a cooling effect, a little bit cooling effect, and you know it's very gentle. The ingredients are not at all irritating the skin. They are very gentle ingredients, no smell, no color. Actually, I can release Ayelet from the bed. Ayelet, you're free. I want to add some more information, but okay. I can.
Thank you.
Thank you, Ayelet. I want to note some more things about Azopil. Most of the time, the patient have home product while he is coming to the clinic every 2 weeks to do the peeling. The spacing between the peelings it's usually every 2 weeks. And in between those 2 weeks, he have products for home use. So it can be Azolite or Azolite Plus or Azocare. So note that if the patient is about to have a visit in the clinic to do Azopil peeling, he should stop using Azolite like 3 or 4 days before the peeling at the clinic. So he will stop applying Azolite. We have the other model coming. So if it's Azolite, so 3 or 4 days before the peeling, you should stop using it. But if it's Azolite Plus, It can be 2 days before. If it's AzoCare, you can not stop and use it straight, without stopping the treatment. And also after the peeling, if the product is azolite, so like 2-3 days after the azopil, you can begin and use the azolite. If it's azolite plus or azocare, I can do it the day after the patient can continue using them the day after the treatment in the clinic. But note that if you're if you're planning to do not only azopil, but to combine like biopil glycolic or biopil lactic in the treatment, so the patient should stop using azolite 5 days before the peeling, not 3-4, but 5 days before because of the HA peeling. And if it's AzoCare or Azolite Plus, it's less. It's like 2-3 days before the peeling. Okay, and maybe last thing, I would say, Azopil is not all the product. We launched it like less than a year ago. When do you use it? When is the good timing? So some cosmetologists first give home products and then combine the Azopil. Some of them start with the Azopil every 2 weeks, and in between you use the products. There is no better approach. Take your consideration and do what's suitable for the specific patient. So let's proceed and speak about the HA peelings, the hydroxy acid peelings, biopil glycolic and biopil lactic. So both of the peelings are 16% concentration, 16% of glycolic acid or 16% of lactic acid. So although they belong to the same family, the hydroxy acid, the glycolic and the lactic, they act differently on the skin. So when we know the differences, you can adjust the correct peeling to the condition of the skin and to the purposes. So let's speak a little bit about the differences between the glycolic and the lactic. So the glycolic acid is a tiny little molecule that penetrates deep and quickly to the skin, but it gives us very effective peeling to treat hyperpigmentation, to do rejuvenation, acne scars, and so on. We use it mainly for the fair skin, like Fitzpatrick 1, 2, 3, 3.5, mainly. If it's Fitzpatrick 4, we can do like one application of the glycolic acid, and the other application will be lactic acid. So most of the treatment for Fitzpatrick 4 will be with lactic acid and not glycolic acid. Also, we are still with the glycolic acid. It can be a little bit itchy, can cause tingling, itching, redness maybe, but so we use it in not very sensitive skin. But if the skin is sensitive, we can do a gentle application with the biopil glycolic. How do we do it? We can dilute, like mix and dilute the peeling, so it doesn't act like 16%, it can act like 8%. If, for example, we mix in the mix bowl, we mix half does, like we take equal parts of biopil glycolic and another solvent, like hamamelis extract, like alcohol, we get less irritative peeling. Yeah, I will show it later so you can also see it, all the mixes. You can do many, you can be creative and do many protocols as long as you understand what you did. So let's speak about the lactic acid. Lactic acid is a larger molecule. It penetrates the skin slowly, relatively compared to the glycolic acid. And also it penetrates to more superficial layer of the epidermis if you compare it with the glycolic acid. And for this reason, it's less irritating for the skin. So the irritation will be less than the biopill glycolic. The biopill lactic have a wonderful effect of raising the glow and the radiance of the skin. So biopill lactic is a milder peeling than biopill glycolic. But if you want to get out of it a deep peeling, you should do 2, 3, or 4 applications to get really intensive peeling. Okay, so when we use the biopill lactic, actually it's okay for all kinds of skin, including sensitive skin, even very sensitive skin, all the skin types and all the skin phototypes with Fitzpatrick. But especially it's very good for the dark skin. So we can do, for example, pigmentation treatment for the dark skin patient, and especially pigmentation treatment for post-stress pigmentation, which the skin is still in stress. Also rejuvenation treatment for all of the skin type, the sensitive, the dark skin, all of the patients, especially if you have a kind of important event and you want to look wonderful in the event, you can do a biopill lactic and get like very radiant skin. So also in this kind of peeling, you can make up to 4 applications, and you can mix them both. Like, for example, you can do 2 applications of biopill lactic and 2 applications with biopill glycolic. The order is less important. Okay, let's start working, and while I'm demonstrating, I will give more tips. So this is Brit. She is our beautiful model. She has a little bit pigmentation in the cheek. I don't know if you see, but I will come closer with the camera. Maybe you will see it better. So let's do the protocol. The first step will be cleansing. So we take equal amounts of soapless soap and skin brush. I will remind you, skin brush is a dermabrasion. It contains tiny particles that scrub the skin. So we take a little bit of skin brush and a little bit of the soapless soap. And we massage the skin. Many times I find that I have to take a little bit of water. We do it for around 1 minute, the cleansing phase. And then after cleansing, we remove it with a wet towel. So we should use a wet towel.
Нам потрібен вологий рушник.
It's important that we remove very thoroughly all of the remains of the soap and skin brush, because the particles, the grains of the skin brush are very little, and it's hard to see them by the eye. So we have to check very carefully. By the way, if the skin is sensitive or irritated while the client is in the clinic, so do not use skin brush, only soapless soap. If you still get a little bit of water on the skin, you can always use some tissue. Okay. Normally, the next step is degreasing, but not every patient needs degreasing. So if it's oily skin, of course, you need to do degreasing. Like normal to oily skin, you do need degreasing, but if it's dry skin, you don't need to do it. And if you do need to do the greasing, we don't have a degreaser, but we have dermapeel, which can be used to degrease the skin. And after the greasing, we actually will do the peeling. So I will use my gloves. In this stage, we have to use the gloves. We choose the kind of peeling that we want to do. So, I decided spontaneously, I will do a Biopeel Lactic for the first, we'll do two applications. So the first one will be Biopeel Lactic. Okay, so we put the gloves, we take the mix bowl, and we pour 2 or 3 ml into the mix bowl. By the way, one entire pipette will be 1 ml. So you can, which one is it? Yeah, it's a new one. So one entire pipette, maybe I'll come closer with the camera. Okay. So one entire pipette will be 1 ml of the peeling. But I don't, I see it by the eye. So we take between 2 and 3 ml of the peeling. We use a gas pad. We dip the gas pad into the peeling. And we put on the entire face area. It doesn't matter where you start, whether in the forehead, but you have to be careful not to put the peeling in the eyelids or in the nasal wings. You do put the peeling in the nose, of course, all over the nose, but except for the nasal wings. Okay, how are you? Okay. Little bit itching? A little bit, from 1 to 10. Not very itching. By the way, our model is a cosmetician. It's herself, so she used this peeling. By the way, let me give you a kind of tip. I put the application on the entire face, and after I finish the application, and I can take a little bit if I have remain, and if not, you can put some drops and accentuate on the pigmentation areas. I don't know if you can see with the camera, but she has a little bit pigmentation on the upper cheeks. So we can like a little bit accentuate this area. So let's come back to me. Okay. So we applied the Biopeel Lactic all over the face. We a little bit added some more peeling to the pigmentation. You don't necessarily have to do it, but you can decide to accentuate the pigmentation area. And we leave the peeling for 5 minutes. So while leaving the peeling, I will maybe give some more tips. First, you have to check on the patient to see if the skin is irritated, to see how we feel. I ask my model, breathe, and she is okay. She's like from 1 to 10, she's 3, right? Some more, like 4, 5, which is normal. It's okay, 4, 5. So in order to make it easier for the patient, I gave her a fan to, to cool the face. Okay. Now, when we do several applications, more than one application, we do in between the application stage, which will be applying aloe vera gel. If we plan to do only one application, we don't need the aloe vera. After the peeling stage, we go forward to calm the skin. But in this case, I plan to do another application. So in between the application, we put the aloe vera. So the aloe vera gel have 2 purposes. It's not mandatory, by the way. You can skip this stage, but it can improve the results. So we use the aloe vera for two reasons. One is to restore the hydration of the skin, because when we do peeling, when we use the biopeel glycolic or lactic, a little bit it compromises the hydration of the skin. And with dehydrated skin, the components do not penetrate very well and do not act very well. So when we recover and restore the hydration of the skin, the next application will do better job. Okay. And the second reason is, of course, to calm the skin. You know, aloe vera can calm the skin. So that's the second reason. If you don't have aloe vera gel, you can use any simple gel you have on the clinic, you know, so you won't get the calming effect, but you will get the hydration effect. So I will put the aloe vera gel. You can spread it with your hand or with a brush, whatever. Okay, we put the aloe vera for 5 more minutes. We waited for, we let the peeling be for 5 minutes. After 5 minutes, we put aloe vera for 5 more minutes. Sometimes when we put the aloe vera, the patient can feel for a few seconds a little bit of tingling, really few seconds. There is an explanation. It's not because of the aloe vera, of course, because aloe vera is calming ingredient, not irritating ingredient. Yeah, the explanation is when you put the peeling and wait for 5 minutes, after 5 minutes, the skin itself will neutralize the acid. You don't have to neutralize the acid. You don't have to remove, to wash, to neutralize. You don't need. The skin will neutralize most of the acid. But there is always some small percentage of acid, like 3-4% of the acid, that was not neutralized. It stays in the superficial layer of the skin, not neutralized. And when we put the aloe vera, the liquid of the aloe vera will activate this acid. And that's why you feel the tingling. We're okay? So after 5 minutes with the aloe vera, we can remove all the aloe vera with wet towel, not dry towel. If we will do it with the dry towel, we can leave the skin sticky because of the gel. So we use a wet towel. And again, if we see some remains of water, we can always use you can always dry them with I use a tissue. And after that, we continue and we will perform the second application of peeling. Now in this application, let's be a little bit complicated. So in this application, I want to do kind of mix. I want to do half of the DAS with Biopeel glycolic and half DAS with Biopeel lactic. So what I'm going to do, I want to put here 1 ml of Biopeel glycolic and 1 ml of Biopeel lactic. This is for the purpose of, for demonstration. And we will get a peeling which the final concentration is, of course, 16%. But in the 16%, we have 8% of glycolic acid and 8% of lactic acid, which, by the way, you can do it for dark skin also. Okay, I ask now my patient if it's still tingling. The answer was yes. But she's still okay, so I'm continuing to do the peeling. Don't forget, you know, the upper lip area. We see a little bit pigmentation. You know, I'm putting some more of the peeling on the pigmentation areas. And as before, we leave the peeling on the face for 5 minutes. So let's come back to me. Okay. We leave the peeling for 5 minutes, so we have a little bit of time to discuss some things. This kind of peeling can be used for you know, several purposes. When we use it for example, a series of rejuvenating treatment, we can do a series with 3 or 4 visits on the clinic every 2 weeks. In that case, we always recommend to prepare the skin, to prepare the patient for this series. In preparation, I mean to give him an exfoliating product like Renew, Bright, Lactofil, but to give him exfoliating product for 3 weeks at least. I prefer 4 weeks to apply the exfoliator every evening. And then a week before the first treatment, he should stop using the exfoliator and the series begins. And of course, at the end of the series, we will wait like a week after the last treatment, and then the patient can continue using the exfoliator. In between the visits, the 2 weeks, don't let him use the exfoliator, only Skin Active or a good moisturizer. Yeah, Skin Active can help recover the skin. The recovery cream will be most of the time Skin Active. Okay. By the way, you mentioned the skin tone. So if the patient is dark skin and we want to minimize the chances to, you know, to cause pigmentation because of the peeling, we can use skin tone a week before the peeling and a week after the peeling. Okay. I said before that you can be creative with the peelings and do some kind of mixing. For example, a little bit of biopil glycolic and a little bit of biopil lactic. You can also do a little bit of biopil glycolic and a little bit of amamelis. Amamelis can dilute the concentration of the peeling. So if you don't want 16%, you want like 8%, you can put 1 pipette or 1 ml of biopil glycolic and 1 ml of amamelis or like alcohol, for example. Or for example, to take like 2 pipettes of biopil glycolic or 2 ml and 1 ml of amamelis. In this case, you will get a peeling with a concentration of 11% because it's 2/3 and third. 2/3 of biopil glycolic and 1/3 of amamelis. So it's approximately 11%. Can be used for like sensitive skin, for example. So we decided on, we planned on doing 2 applications. We we had 2 applications. We gave like 5 minutes for the second application. And because we don't plan on another application, we don't put aloe vera, we proceed to the next stage, which will be to calm the skin. So we use calming mask. Let's get closer. This is calming in a cabin size, of course. And we put a generous layer of calming mask. I use the brush. You can use whatever, your hand, your brush. So you spread it all over the face and leave it for 10 to 15 minutes. So I will use this time to give some more information while we wait with the calming mask. Okay, so we leave. Also, in this case, when we put the calming, maybe the patient will feel a little bit of tingling for a few seconds, as I said before, with the Azopil. It can happen and it will pass quickly. As I said, the calming has an occlusive effect, so it a little bit hits the skin, but at the same time, the calming ingredients start to work and to calm the skin and to help recover the epidermal barrier. So, you know, the benefits are much better, much greater. Okay, let's have some more information. When we plan on doing the peeling, the patient should be stopping with any exfoliant he was using before at home, if it's a professional exfoliating product or a prescription like tretinoin, or I don't know if they call it in Ukraine, but a prescription ointment with retinoic acid. Okay, so you should stop them a week before the peeling. And after the peeling, the patient can go back to using the exfoliate after like 4 days on calm skin, recovered skin, not reddish, not flaky skin. If the skin is okay, you can like in 4 days go back to the exfoliant. Now, when the treatment is a part of, you know, in a series of treatment for rejuvenation, like once in 2 weeks, this is one option. You want to like take a patient and give him a very youthful and smoother and a very good texture. So you prepare 3 to 4 treatment in spacing of 2 weeks. But if it's part of pigmentation treatment, it's another case. If it's a part of pigmentation treatment, the spacing between the treatment will not be 2 weeks or 3 weeks, because most of the outcome, we get it from the home products, from skin tone and exfoliator, and the peelings in the clinic will be performed once in a month or even once in a month and a half. Okay. So in the meantime, I checked on my client, she is okay. And I think I don't have, I maybe don't have 10 minutes, but I will remove the mask since everything is okay. So we use a wet, not wet, sorry, dry towel. We can choose to leave a little bit of the amount of calming on the skin, you know, for to continue the action. If you leave a little bit of calming, you will get the continuation of the, the relaxing effect of the calming, and also the skin gets more even when you look at it. This is the advantage. The disadvantage is the smell. It's not a spa smell. Now, normally the next stage will be recovery with Skin Active. But before Skin Active, you can use a spring. Spring, as you know, maybe we come closer. Spring is a massage serum. You have to shake it. You shake it to mix the two phases, the oily phase and the hyaluronic acid.
Component.
Also, this really smells very nice. It's not mandatory, but you can spoil a little bit your patient and do the stage. Maybe I put a little bit, I don't know, maybe too much. So but you can already see that the skin is very radiant, shiny. Yeah, we will later come closer, and then the final step will be recovery with Skin Active. So this is Skin Active, the cabin size, of course. We will take a little bit of Skin Active. The remains we can massage to the neck, of course. And if we want, it's not, I will take out my gloves. If we want, it's not mandatory. We can take a little bit of glow, and yeah, so the glow cream can give us, the glow effect, like shimmer all over the face. So we can put some points of glow. I think I took too much.
Взяла.
So the skin is now more glowing. Yeah, maybe go a little bit down. Yeah, so yeah, now you can see the forehead. Okay, so let's come back to me. Hi, so this was the hydroxy acid peeling, biopilglycolic and biophylactic. And now if you have questions, I will be happy to.
So as for the degreasing stage, so do we use only Dermapil? Yes.
Yeah, we can use Dermapil, but pay attention that if it's very sensitive skin, maybe it's not a very good idea to use Dermapil before the peeling, because in very sensitive skin, it could cause irritation. But in normal skin, every other skin, yes, you can use Dermapil for the greasing.
But only Dermapil, not double pill, only Dermapil.
No. Double pill is a home product.
And one more question, if we can use aloe as the mask as with like a dense layer, rigorous layer of it.
I'm not sure I understood. She wants to
A lot of aloe gel on like a mask.
It depends in which stage. In between the application, she have to put a generous layer of aloe or aloe vera in between the application. I don't recommend to replace the calming mask with aloe vera. So calming mask is needed it's part of the protocol.
If we are talking about aging patients, like with hyperpigmentation, where patients elder than 55, for example, with hyperpigmentation, how can we treat them? Like what can we use?
Yeah, so that's a good question because it depends what is your priority as a cosmetician, but more important, what is the patient's priorities? Because you gave an example that it's aging skin with pigmentation. So if the priority is pigmentation, so give her a pigmentation products for home use and space the peeling treatment once in a month. So she get the pigmentation treatment at home, good pigmentation treatment with skin tone and renew, for example. And once in a month, she come to the clinic and get a good peeling at the clinic. Because otherwise, if you want to, if the client's priority is to get in a short time very nice skin, so go for a series once in 2 weeks, a visit on the clinic, and do in the first visit 1 application, and the second visit 2 or 3 application, and the third visit 3, 4 application. So if the priority is in a short time to look very nice and very groomed skin, go for the series of treatment, 1 in 2 weeks. If the priority is to treat the pigmentation, so every month in the clinic, and for home use, she will get renew and skin tone.
And can you please tell me how resultative they are? Somebody asked, so you were talking about aging skin, how resultative these treatments are? Hyperpigmentation in aging skin.
I'm sorry.
Is the result good?
Will the result be good? That's
yes, yes, in aging skin.
So it's a good question. We have to set expectations because we have many ways to treat signs of aging. It depends which signs of aging. For example, we have a phenomena which is called aging pores. Many large pores that appeared with aging. So for this phenomena, for example, I recommend to do microneedling or maybe fractional radio frequency. It's a device. So we have many kinds of treatment to aging skin, and it depends on what you want to achieve and what can be achieved with a peeling and what can be achieved with a microneedling. And by the way, you can combine microneedling with the peeling. Important, not in the same visit, but you can do a certain visit to do microneedling, and 2-3 weeks after, you can do the peeling. So you get the benefits of all kinds of treatments. I said earlier that you have to set expectations. So you have to know what you can achieve with the peeling and what you can achieve with other treatment options. For example, if you want to rely on peeling, on series of peelings, what you will achieve is a more radiant looking skin, more youthful skin, more plumpy and even toned skin. I said radiant, a little bit of improvement in the pores, you will achieve. And the skin will look more alive, but it won't treat, for example, wrinkles or even fine lines. And if you want to achieve more firmness of the skin, you should go to micro needling, for example. If you want to improve wrinkles or like fine wrinkles and improve elasticity and improve the thickness of the skin, go for micro needling. If you want to improve the general texture and the radiance and the youthful of the skin, go for peelings.
So one of the colleagues has patient who is sportsman and takes some supplements, food supplements for sport, and that's why it appears some rash, some acne on his skin, on her skin. What can you recommend?
Same treatment as he wasn't a sportsman. I know the supplements, they take proteins generally, and the proteins can cause some rash. But I will never say to anyone, stop doing sport. I do sport. This is good, even for the skin. But same treatment for the rash, using it depends on the severity of the rash. So if it's mild, you can use AzoCare at home or Azolite Plus and do Azopil at the clinic.
The question regarding the depth of the peeling, of the penetration. So how do we control the depth of the penetration, and how do we understand how deep it is in the skin? So is it like on surface, on middle derma, or some? How can we control the depth of the penetration?
You don't have to control, you have to only understand. First, the depth of the peeling, it's always on the stratum corneum only. It's always on this, we have many layers in the stratum corneum, and the glycolic or lactic acid peels penetrate to the superficial layers of the stratum corneum, not more, because we need the stratum corneum. No patient goes out of the clinic without stratum corneum. We need it, otherwise that's a burn. That's a second degree of burn. So we exfoliate some superficial layers of the stratum corneum. Glycolic acid penetrates a little bit deeper than the lactic acid, and the more application you do, the deeper peeling you get, but it's always on the stratum corneum. I will add another thing. I don't know, maybe the question was before, because when you do TCA peeling, which you don't have TCA, it's a medical peel, but when you do TCA, you cannot control, and you can reach to layers that you didn't want, and you also cannot neutralize the TCA. You cannot. So you have some little bit of risk. It's a good peeling, but you have a little bit of risk. But glycolic and lactic acid are not like TCA. You don't reach very deep in the skin, and you can always neutralize with, even if with water, you can neutralize the peeling. So no more questions?
Seems that's it.
So this is it for the peelings. Of course, you can find some protocols in the booklet, in the professional booklet, but this is the basic. And from here, you can be creative and make your own protocols according to the purposes. For example, I could add one application of Azopil. In this case, when I'm treating now my model, she's called Brit, and she has a little bit of pigmentation. So I did 2 applications of Biopil lactic, and then a mixed pill with Biopil glycolic and lactic. And then I could do a 3rd application with Azopil. I could do it. So you be creative. You do what you understand, as long as you understand. Okay.
One more question. Sorry. When doing extraction, Do we, at first, after cleansing, we use Dermapil, then we make extractions, then we use Dermapil again, and do we need to rinse it after this, before we calming the skin?
What do you mean extraction? You mean
I think that they mean acne extraction, like drainage of comedones or something.
yeah.
the drainage.
Yes, they call it extraction. It's like
So again, you do the first the initial cleansing, you do Dermapil, you
do extraction. Yes, this drainage.
No. That's not the order. If you want to do extraction of comedones, you do the initial cleansing, you do Dermapil, and then you use one of the peelings to prepare the skin for the extraction. So you can do Azopil. You can do a mix of a little bit of Azopil and a little bit of the like Biopil lactic in the same mix bowl, and do the peeling. You can do one application of Azopil and one application of Biopil lactic, and then the extraction. But we recommend to prepare the skin for extraction. Okay. By the way, we have yet to come a plumping gel to prepare the skin, but it's not yet available. So you have to prepare the skin for the extraction.
But the question was after the extraction, they use Dermapil as the disinfection.
Yeah, this can be done.
Yes, and do they need to rinse it before calming?
No. But by the way, she doesn't necessarily have to use Dermapil before calming, because calming is itself disinfectant.
Right. Thank you very
Thank you all
much,
for
Ronit.
being with me. Thank you for having me.